Okay, I will be doing a newborn assessment on this female baby that was born 2 hours ago. And I did hand hygiene before coming into the room. So first I would check the baby's ID bracelet, make sure it matched up with the mother's, and this is the right baby. And I am just making sure that the blanket or the baby has a warm blanket on, so it's swaddled right now, and she also has a hat on. So first I'm just going to check the baby's vital signs, and I'm just going to watch her respirations and count for a full minute. All right, so I'm going to say it's been a full minute, and the baby had 46 breaths per minute, which is normal because the normal for a baby is 30 to 60 breaths per minute. So next I'm just going to count the baby's heart rate, and I'm going to use my stethoscope for this, but I'm going to make sure my stethoscope is warm before touching the baby's skin. So I listened for a full minute, and the baby's heart rate is 130 beats per minute, and that is normal since the normal heart rate falls between 110 to 160 beats per minute. So while I have my stethoscope out, I'm going to go ahead and listen to the baby's lung sounds to make sure the lungs are clear and have no fluid or anything. So next I would be doing the baby's blood pressure, and if I had an actual size cuff, I would be doing it on the leg. And the blood pressure I would get would be a systolic between 60 and 80 and a diastolic between 40 and 50. Lastly, I would check the baby's temperature. So right now I would do axillary, and the temperature comes out to be 37.1, and a normal temperature for a baby is 36.5 to 37.5 degrees Celsius. So first I would start my assessment on the top of the head, and I would remove the hat for this part. And I would just measure the circumference of the baby's head. So I got 34 centimeters, which is normal because it should range from 32 to 37 centimeters. And next I'm just going to feel around the head for the fontanelles and the sutures, making sure there are no big gaps between the sutures and it is palpable and not bulging. I'm also going to check to see if there's any swelling or bruising or any bleeding, just to see if there's any injury from birth. So everything seems to be normal with this baby. Next, I'm going to check the ears and make sure they are in line with the inner canthus of the eye, make sure there are no skin tags, and that the cartilage in the ear is fully developed, which everything looks normal, so I would go ahead and put the hat back on the baby. So the next thing I'm going to look at is the eyes, to see if the eyes are evenly spaced, which they are. There's no pussing or redness coming from the eyes. So next I would just shine this light to check the baby's eye color. And this baby's eyes are blue. It's normal to see blue or gray eyes with newborns. And next I would check the baby's nose. I'm gonna check the patency of the nares to see if there's any blockage or anything, since babies are nose breathers. So I would go ahead and block one, and they're able to breathe out of that one, and they're able to breathe out of that one. Next is the mouth. So I'm just going to put my finger in and feel if the soft and hard palate are developed, which they are. And I see that the tongue is freely moving, and I don't see any white spots, but if there were white spots, those are Epstein pearls, which are normal for this for a newborn, and they can go away pretty quickly. So next I would check the neck, and I would see that this baby has no webbing and the neck is freely moving when I do that. All right, so I'm gonna move on down and just uncover the baby a little bit just so that her chest is showing. So I'm just gonna go ahead and measure the circumference of the chest. and I do see that it is 33 centimeters. A normal finding would be 30 to 35 centimeters. The chest is a barrel shape. There are no signs of retractions with respirations. Both of the clavicles are intact, so there are no signs of injury from birth. Next, I would look for the nipples, and the nipples are fully formed, and they look to be about 3 millimeters, which a normal finding is from 3 to 10 millimeters. And if you do see some white discharge coming from the nipples, that is normal because of the hormones from the moms. So moving on down to the abdomen, you can see that the umbilical cord should be intact, which it is, and it is a 3-vessel umbilical cord, so I see 2 arteries and 1 vein. There are no signs of infection, which is great. And next, I'm going to check for bowel sounds in all 4 quadrants. Alrighty, and for this next part, I would don gloves, and I'm just going to check the baby's peri area. So I would pull the diaper down, and first I would check the patency of the anus. So I would plug my finger over the anus, and with stimulation, you should feel a little bit of movement. Just make sure there's no membrane so that, and I see that this baby's is patent. And since this baby is a female, it is normal to see some red spotting, which is just the hormones from the mother. And you should also see the labia majora should be over the labia minora and the clitoris. If this were a male, you would see rugae on the scrotum, the testes in the scrotum, and the urinary meatus on the top of the penis. So within the first 24 hours, the baby should have a wet diaper, and it is normal to see brick dust. It's just from a lot of uric acid. So now seeing the trunk and the face of the baby, those are almost the most important part, especially right at birth and a little bit after, that the whole body is pink from what I see right now. So that is really good. It should not be blue or any signs of cyanosis so far. So next are the extremities. Now, so far in the extremities, I see all pink, which is good. There are no signs of acrocyanosis, but it is normal to see a little bit of paleness or blueness in the extremities because of the acrocyanosis. This baby does have full movement of the arms, and if I move the hips out and up and back, there's no clunking sound, which is good. So next I'm going to carefully turn the baby over so I can see her spine, see that it is in a line. There's nothing missing. There are no tufts of hair or anything, so everything looks normal. I'm going to bring the baby back over. So lastly, I'm going to check the reflexes. So first I'm going to do the Moro reflex. So I'm going to act like I'm dropping the baby, and a normal response would be the baby to flail out and act surprised, which she did, so that's good. Next is rooting, so I would put my finger on the side of the baby's face, and the baby's head should turn toward the finger, which is normal. Next is fencing, so I should turn the baby's head a certain way, and that side of the body should flex out with it, which she did. Next, I'm going to do the Babinski. So on the bottom of the foot, you should make an upside down J, and the baby's toes should flare out, which is normal for a while. Lastly is the plantar and palmar reflexes. So in the palm, you should put your finger right below the fingers, and the fingers should grasp your hand, which she did. And then on the feet, if you put your fingers in the same spot, they should turn in or grasp a little bit, which they did. So now I'm going to stand the baby up for the stepping reflex, and put the feet on the bed lightly. And if they make stepping motions, that is normal. So now I'm going to lay the baby back down, wrap her all up, make sure she's warm. And everything appeared normal, so I would just document that everything is normal.